You're watching Channels Television. Welcome to Health News. I am Yomi Otaigbe. Nigerians seeking medical services in most public hospitals nationwide are groaning under the weight of the effect of the strike action by all health workers except the medical doctors. Nurses, medical lab scientists, pharmacists, physiotherapists, and a host of other health workers have been away from their duty posts for well over 2 months. This is the emergency ward of the National Orthopedic Hospital, Igbobi, Yaba, Lagos. The ward is completely deserted. Everything left behind by the health workers remains the same. Indeed, dust has taken over. It's the same situation in most parts of the hospital, except for a few wards where we found some patients who perhaps have no other option. Such is the case of 51-year-old Mr. Innocent Okwarokere, a spinal cord injury patient. He's been on hospital admission since the last quarter of 2014.
I had an accident, paraventure by September, October. I was treated very well with the doctors and nurses before they embark on strike. This is 2 months now on strike. It's only doctors that come and prescribe our drugs. We are not seeing nurses. You see my leg, you see my hand. It has been a difficult situation since the nurses have been on strike, because they are the hardest people to our patients. Without them, the health issue will not go smoothly. And since they have been on strike, we have been praying that we know that the heart of a rich man is like a raining cloud. Nobody knows when it is going to rain. Let the government see their plight and call off the strike so that they come back to their work and see their patients.
While the patients grapple with their situation, members of the joint health sector unions protest in some parts of the country against what they described as the foot-dragging posture of the federal government. The health workers want the implementation of the National Industrial Court ruling on salary adjustment and skipping of Consolidated Health Salary Structure, CONHES 10, among other demands.
We have about 11 of them. Issue of promotion of our members who have been stagnated, some of them up to 15, 16, 17 years on the same level. They've been on CONHES 14 for many years. That's moving them from 14 to 15, which is grade level 17. And that is implementing the circular from Office of a Staff, Office of the Head of Service, since February 2001. That is one. Issue of skipping of 10. Issue of arrears on skipping of CONHES 10. Issue of retirement age of 65. University presently enjoy professor retire at the age of 70. Other workers in the university retire at 65. And we have judgment that state clearly that teaching hospital, research institute of university are supposed to enjoy the same condition of service. Since that of university has been done, that of teaching hospital is yet to be addressed, and the research institute. Issue of the adjustment of salary allowances is yet to be done. Issue of circular for medical laboratory scientists, intern, to be on CONHES 8 like other colleagues in the health team is yet to be addressed. And then post-NYSC to start on 9 is yet to be addressed. Issue of nurses having one harmonized scheme of service based on industrial code yet to be addressed.
What you are seeing here is a demonstration of the resolve of all health workers in the Federation of Nigeria that we are displeased with the nonchalant attitude of the federal government towards meeting the demands of the union. We have been on this issue since the NIC judgment that was delivered in July 2012. And we believe that if the Constitution is supreme, if nobody is above the law, federal government, who are supposed to be the custodian of enforcing the Nigerian laws, should listen to the national leaders of JOHESU, who have galvanized all our demands and needs together, aimed at providing affordable health services, uninterrupted health services to the teeming populace of Nigeria. This rally, or what you are seeing here, is to appeal to the consciences of well-meaning Nigerians to prevail on the authorities concerned to see what is necessary for them to reopen the health facilities across the length and breadth of the nation, both the federal, the state, and the local government.
Since this strike by the health workers began on November 13, 2014, there have been various meetings between the federal government team and JOHESU, but the issues at stake remained unresolved. However, Nigeria's Supervising Minister of Health, Dr. Khaliru Al-Hassan, said the federal government is working towards resolving the issues.
From day one, we knew what they are agitating for. Their demands are well known to the government. And also the government response has been made clear to them. A lot of issues that bordered on relationship in the Ministry of Health, we have taken the necessary steps to address those issues with them. But there are other issues that are not depending only on the Ministry of Health. There are other stakeholders, issues about money, issue about circulars. You know, they involve other ministries like the Office of the Head of Service, the Office of the Minister of Finance, Salaries and Wages Commission. A lot of those decisions have to be taken from other sections. The judgment that has been said is clear, but we said from day one in 2014, we have not budgeted money for those settlements. What we have been appealing to JOHESU is that yes, there is judgment of the court, and we are bounded by that, and we are willing to take it the next level. What we want for them is to call up the strike. Please come up. We have a joint committee to look at the demands in details and come up with a work plan on how we are going to get it done. We know for an effective healthcare delivery, we need the whole team to be working together as a team. Not only the doctors, we require the nurses, we require the pharmacists, the lab scientists, even the medical record officer. So you can imagine, yes, their absence has really affected the way their hospitals should be operating 100%. So there's no denying the fact that, yes, it has happened, but on the larger picture, we feel their absence is also causes a lot of threats. We have looked at the wonderful job that Mr. President has done in providing leadership for us to work together with other stakeholders to eliminate Ebola in the country. The absence of JOHESU have left our planks open because some of the members who are supposed to be checking our border port of entries are not there. This is it's a huge threat. As you can see, we have succeeded in Nigeria in controlling Ebola. We have eliminated it. But other countries are still facing a lot of challenges, and we need to be very focused on that. And the only way is to be on your duty post, and I think that will not stop us from continuing to have dialogue on their demands. As of now, as we speak, just members are enjoying their salary. Not a kobo has been taken away from them. We have never in any way threatened them with that. All we have been saying is that they should come back to work. We should continue to mediate. As far as the labor laws are concerned, they are clear. It's an option for the government to do, but we are not really taking it. We want us to work in unified fashion. We want them to come back to their duty posts. We will continue to support and protect Nigerians entirely. We must be united in this, and we want them to be back to their duty immediately. We believe presently the present administration has done a lot to ensure that the health care delivery in Nigeria has been improved. And the relationship within the interprofessional conflicts that we have been experiencing in the medical industry has been addressed. Mr. President has received the report of the IALA committee, who has been specifically designed to look at the tension areas within the various members of the profession. Now they have submitted their report. A white paper committee has been formulated and has already started sitting. These are all, in fairness to say, the government has cleared the way for us to come to work together as a team. I believe JOS members have heard about the report. It has addressed most of the issues that are in contention, and we are hopeful that with this, it is going to be a strike-free 2015. And we look forward whereby all members of the health team will have a new rethink and dedication that we are going to be patient-oriented in all our actions and decisions. And of course, we also are aware that the National Health Bill has been signed into an act, which this is a great master stroke by Mr. President, which will ensure that there will be better health care delivery in 2015. This act will ensure more funding, in particular to issues of maternal and newborn child health. But to go beyond that, it addresses a lot of other much more serious healthcare delivery issues facing us. It ensures that the barrier, that is the financial barrier to average Nigerian in going to the hospital, is no more there. There are enough facilities with well-equipped and personnel to ensure that healthcare is given even in the remote areas. And the greatest difficulty has been financial barrier. Now with the National Health Bill being into law, that has been eliminated. We are confident that 2015 is the beginning of a greater health achievement in the country.
Now, what's your take on all the happenings in Nigeria's health sector? We'd like to hear from you. Do send your thoughts to healthnews@channelstv.com or send an SMS to 081-864-38129. We can also extend the conversation on Twitter at @yourme_Otaigbe.